The thing about eyelid surgery, to me, that is scary is that, I mean, it's your eyes,
yeah,
right?
yeah.
Right?
Yeah.
What do you say to someone who comes in for a consultation and they're interested,
Yeah.
but they're also a little like, wait a minute, Dr. Park, don't mess this up.
Yeah.
What do you
seriously.
say?
Well, I say the eyes are the windows to the soul.
Well,
So we've got to address this. It's
Right.
very important. People think that we're operating on the eye. We're not. So your eye does remain closed. So it's very, 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 very safe.
It's the
So
skin around the
It's
eye?
the skin and the
Okay.
fat around the eye that we're addressing. So it's all above and away from the eye per se.
The eyeball.
The eyeball
Got
is
it.
Okay.
protected and
that already calmed me down a little
Yeah,
bit. So anybody
Yeah.
listening, I hope that calmed you down as well.
Welcome to Care Experts, a podcast dedicated to providing the inside scoop on health and self-care.
Make sure you join us each week for candid conversations with wellness and medical specialists.
Yes, real experts here to help you make the best choices for you and your loved ones.
I'm Melissa, a native Texan living in Atlanta.
And I'm Sayla, a Californian through and through, and we're your co-hosts.
That's right, we're both proud moms here to have meaningful conversations with experts from all over the country who empower, inform, and inspire.
From cosmetic to dental and vet to vision, this is Care Experts. Melissa, you were just saying.
What?
Well, you were looking at your baby monitor and saying, they're so cute with their eyes closed.
Well, I mean, they all look like little angels, Sayla, when they're sleeping. It makes you think, oh, I could do it all over again. And
It's a
then
trap.
it is a trap. And then the reality of like what it's like to actually be a mom 24/7. It's like,
and then you do that 3 times.
well, I'm one and done. Okay.
But you're right, they are so angelic
When they're sleeping, yeah.
And it made me think of what we're talking about today, which is eyelid surgery.
Eyelid surgery, which is something that I'm not familiar with at all. It's something that you would do like way later in life,
I
like
know.
as gravity starts to really take hold.
Totally.
And you're thinking, oh, well, it's starting to droop a little bit. I want to correct that, so I can see better and feel prettier when I look in the mirror. So we're going to talk to our expert today, who is Dr. Edward Park. And he honed his skills and expertise in plastic and reconstructive surgery at Stanford University,
No big deal.
progressing from internship to chief resident.
I mean,
Wow.
as you do.
I mean, as one does.
Yes. At Stanford, he also conducted groundbreaking research in wound healing and stem cell research, earning him a prestigious national research grant from the Plastic Surgery Educational Foundation.
And Dr. Park is a board-certified plastic surgeon recognized by the American Board of Plastic Surgery and the American Society of Plastic Surgery. That's major.
Yeah.
Uh-huh.
And sounds important. He's the owner of Face and Body Cosmetic Surgery in Upland, California.
I am so excited to learn more about eyelid surgery, what it entails, recovery, aftercare, all of that. Who's a good candidate for
Exactly.
it?
Especially from someone with Dr. Park's expertise. I mean, he is truly, look at all
In a
these-
league of his own.
I know.
Yeah.
I
So
mean,
let's bring him
incredible.
in. Dr.
Yes.
Edward Park, come join us and tell us all about eyelid surgery.
Yes. Hello, Dr. Park.
Dr. Park is in the house.
Good to see you.
Thank you.
Good. Thank you for being here. We are so excited today to talk about so many things. But first of all, I heard you have a love for cars. I wanted to hear about
No,
this.
it's not a love. It's
A
a passion.
passion.
It's a passion. A
Yes.
need for speed, if
Oh,
you
there
will.
you go.
There you go.
Uh-huh. Tell us about
Goes
that.
straight to my heart.
Oh.
Deep passion.
Really?
Yeah, a lot of plastic surgeons, we call ourselves adrenaline junkies. We seek it, we thrive it, and I had the opportunity to race Lotus cars back in the day for fun, and that just kind of instilled this passion. And it's funny, I use racing a lot to teach my surgical techs some analogy about looking 2 corners ahead and things like that.
wow.
So it's fun.
Not going too fast.
Sometimes go faster.
Oh, man.
Okay.
Yeah.
Have you ever been to the Ferrari racetrack in Italy?
I haven't, but that's like a
I've
dream
been
of mine.
there.
What? I'm
My husband and I drove
super
on it.
jealous.
I know. It was amazing. You
I'd
would love it.
love to go
Have you been to the one
yeah,
here in
one day now.
California? Is it Porsche?
I've been to the
Porsche
Porsche
one?
track experience. I've
Okay.
done that,
How's
and I've
that?
raced a lot of tracks. It's a blast. I mean, once again, if you want your heart rate to go up, you get behind a race car. You'll love it.
On that Ferrari track, you can. It was in the old days where we had the digital cameras. I was trying to film it, and the camera drops, and all you hear is me screaming for my life.
Oh yeah, that would not be me.
So scary.
Is not fun in a race
it was
car.
No, thank you.
You want to be the driver.
I'll just wave at y'all as y'all zoom right on by me.
I should have done that.
Are you saying, Dr. Park, if you were not a surgeon, that you'd be a race car driver?
Formula One driver absolutely would be my number one passion.
Oh my gosh.
Followed closely by maybe a pro golfer, but
Oh, really?
those talents are a little.
Oh,
So
okay.
Lower.
very different too, by the way.
Yeah.
Pro golfer and race car driver. I mean, I feel like they're very different.
Very different, but also kind of like individualistic. I don't know why. Maybe I'm not a team player that I count on me. Like
Yeah,
in surgery, I'm not
count
a
on
team
me.
player. I got to do everything myself. A little bit of a control freak, maybe.
Hyper-focused during
Yeah.
surgery.
Very
It
hyper-focused.
served you well because you are one of the most prolific and well-known plastic surgeons in California, and
Sought after.
sought after. Thank you. Yes, and you have so many different skills that you do. One of the things we're going to talk about today is your specialty in eyelid surgery, which is also known as.
Blepharoplasty.
Thank you.
Correct.
I was
yeah.
like, I don't know how to say
I don't
it.
know the proper term.
Yeah.
Okay.
I'm
But
not
It's
the
a long
doctor.
word.
just for our listeners, I want to make sure I get this in. You are a board certified plastic surgeon recognized by the American Board of Plastic Surgery and the American Society of Plastic Surgery. That's a big deal,
Yeah.
okay? And that you honed your skills and your expertise in plastic and reconstructive surgery at Stanford University, right? Go Cardinal, right? Is
Go
that the-
Cardinals,
Yeah,
yes.
go Cardinals.
Yeah,
there
yeah.
you go. There you go. What led you to the field of plastic surgery?
Wow. My kids ask me, what do you do at work, Dad? And I said, well, I kind of build humans kind of like you're building Legos.
That's awesome.
And, that kind of passion I had as a kid, of course. I built Legos, I built model airplanes, I played the violin. So I wanted to do something super creative. And so plastic and reconstructive surgery, we operate anywhere. We learn and train to operate anywhere and everywhere. We're talking craniofacial, cleft lips, burn surgery, hand surgery, reconstruction, microvascular. So our field is the most complex and intricate, but also the most creative and fun. So that's
Yeah.
what I love
Where
about
science meets art.
it. Absolutely.
Oh, I love that. That is
I'm
so
going
good.
to use that.
Oh, you can have it. It's yours.
That's awesome.
Also, you have specialized interests in facial aesthetic surgery, breast and body contouring surgery, which I feel like I hear more and more about contouring types of surgery. So I want you to go into a little bit of detail about that. And minimally invasive procedures. Are the eyelid procedures that we're about to talk about, are those minimally invasive?
Minimally invasive usually refers to very small incisions and sometimes using a scope. So, but the point is, I definitely want to make as small scars as possible. And for example, if we go into our field, we try to disguise all our scars. And so, for example, if you were to ask me, how do I approach the lower lids, like the fat bags, I'm going to go behind the lid. So it's scarless. So things like that.
How many different types of eyelids and underlid, I guess, surgeries are there?
First of all, we can separate into the upper and lower lids.
Okay.
And so someone may just be interested in kind of the upper lid skin that's dropping over time.
Is that called the hooded?
That lateral hooding of the
Okay,
upper
okay.
lids. So we start seeing that maybe at age 40 and up. Someone can see a little bit of skin. And then the lower lids are then approached when we're talking about the fat bags and grooving in the nasolabial area.
Okay.
So it's a pretty complex area. Yeah.
Do people usually do both at the same time, or is that not what the
Yes,
typical
they
practice
can.
is? Oh, okay.
But oftentimes what I do is I try to make sure I understand what their goals are. Because sometimes, for example, they say, hey, Dr. Park, I see some hooding here. Can you take care of that? And I always do a holistic evaluation where I say, hey, I'm going to look at your upper lids, but I'm also going to look at your lower lids. By the way, yeah, there might be a little bit of fat there that we can address. They can still say no to that, but I like to make sure everything's covered.
I had a friend who did it, and she said it was absolutely life-changing.
But both?
Yes, both. Her eyes were like closing in on themselves. She
Yes.
couldn't see as well. So it literally opened her eyes.
It literally opens your eyes. And some people, when they get very, very old, they can get obstruction of the skin over their visual field. So that can happen. But to your point, it's like, I want to brighten their look.
Yeah.
And to your friend's point, they probably feel and look brighter.
Yes.
But also very important not to overdo it so that it looks natural.
Oh,
We don't want them to look overdone like the celebrities do it. So it has to be done naturally.
So you have seen celebrities overdo it?
We've seen like the Kenny Rogers or the Joan, where the brows are peaked up a little
Yeah, I've seen
aggressively.
that,
And,
yeah.
I gotta Google this now.
Yeah.
You
you'll
haven't
see-
seen that?
No.
Get
Some
out.
people-
It's everywhere. And I love Kenny
people
Rogers.
Yeah.
Yeah, really? Yeah, I love him. Okay,
So
so the thing about eyelid surgery, to me, that is scary is that, I mean, it's your eyes,
Yeah,
right?
yeah.
Right?
Yeah.
It's your
Like
your
somebody's
eyes.
going in.
How do you
Yeah.
what do you say to someone who comes in for a consultation and they're interested,
Yeah.
but they're also a little like, wait a minute, Dr. Park, don't mess this up.
Yeah.
What do you
seriously.
say?
Well, I say the eyes are the windows to the soul.
Well.
So we've got to address this. It's
Right.
very important. One thing that is scary is people think that we're operating on the eye. We're not. So it's not like we're not touching the eye. Your eye does remain closed, so it's very, 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 very safe.
It's the
So
skin around the
It's
eye?
the skin and the
Okay.
fat around the eye that we're addressing. So it's all
Interesting.
above and away from the eye per se.
The eyeball.
The eyeball is
Got it. Okay.
protected, and even though people say, "Oh, there's a risk of blindness," that really never ever really happens.
Okay, you never seen
Right.
That already calmed me down a little
Yeah,
bit. So anybody
yeah.
listening, I hope that calmed you down as
Yeah.
well.
Yeah.
What's the timeline for that? So let's say I don't want to do a double lid surgery.
Right.
I only need the upper.
Correct.
What is that timeline? What's that process look like?
So eyes are one of my favorite because number one, it's going to brighten your look, and number two, it's probably the most quickest, easiest, and painless surgeries you'll ever go through.
Amazing.
So let's say we do a consultation and we sign up for surgery. I usually will do upper lids, and it'll be done generally under a twilight or a local sedation. You don't even have
That
a
was my
breathing
next
tube.
question. Do you have to go
What?
under?
It's
So
very
you don't have to
easy.
go
You
under.
don't have to
No
go
general
under.
anesthesia.
That's amazing.
I remember doing my father under a local.
You did your father?
Yeah, that was pretty hairy.
Oh my
Did not want
goodness.
to mess up.
Oh, no, you did not. Uh-uh.
He would have had a lot to say.
I'm
Unless you have
sure.
a terrible relationship.
No, we had
I'm just kidding.
yeah. But I basically said, Dad, you don't need any medications. I'll just numb you up. A little painful in the numbing part, but
Yeah,
he got through it.
He did.
But easily done under a local sedation, 30 minutes, icy eyes for a couple days, sutures out in 1 week, go to a very nice dinner at Maestro's. Done.
Done
my
and
goodness.
done. Okay. How much is something like that ballpark figure for just the upper eyelid surgery?
That's a good question. That can range from geographic area.
Sure.
But I think the average is going to be about $4,000 to $6,000 just
Total?
for total.
For the upper.
Oh, for both
Yeah.
eyes.
Is
Okay.
that
Yeah,
covered by
absolutely.
insurance at all, or is it financed?
I would say that it's covered in the older population where they do get obstruction of the,
Okay.
and it's they have a exam that shows visual obstruction. So more in the elderly patients.
Is it genetics or maybe possibly a combination, genetics, or is it the aging process naturally is going to make your eyes start to droop?
I'd say a combination of both.
Okay.
And a lot of people will come in and they'll say, my mom had these bags, or my dad, and I'm getting him too. So that's the genetic component. But for sure, that and aging, we all can't fight time. We're all going to have hooded lids and some fat protrusion.
Can we prevent it?
That's what I was going to say.
The ice
when you-
packs, the cucumbers.
Every day,
is there anything-
every
every
day.
day.
Yeah.
Yeah, we can't turn back Father Time, but yeah, so eventually.
When is the best time to address it then? So is it when you first start to see, if I'm your patient, is it when I first start to notice a difference in the way my eyes look? Or if I'm starting to see an obstruction, the earlier the better? Or do I wait until it becomes more pronounced?
Right. That's a really good question. And I often say, well, it's really up to you. And then what I say to them is, because usually when they're in my office, they're wanting to it's bothering them to some
Yeah.
degree.
Sure.
So I basically say, it's not too early if you are noticing it every day in the mirror. If it bothers you every day, it's probably time to do it.
Okay.
That can be at age 45. It could be at age 65. So kind of like when you feel comfortable
If you did it at age 45, would it then, what would happen? Obviously, you're still aging.
Yeah.
Would you have to do it again?
How long would it last?
Yeah, how long would it
Yeah.
last?
So that's a great question. Like, how many revisions do we need to do in different surgeries? Eyelids are fairly stable, and it's pretty rare to do a second eyelid lift unless it's about 20 to 30 years later.
Okay.
Now, for a facelift, that does not last as long. They may do a refacelift at maybe 15 years later.
Okay.
But eyelids are fairly stable.
And the same probably eyelift is similar to facelift. You would have to
Correct.
redo that. I
Yeah,
see. Okay,
that's that
makes sense.
eyelid lift, blepharoplasty.
Yes.
What are the characteristics of someone who's a good candidate for eyelid surgery?
It's usually when they're ready mentally, you know, and they say and they point out, and I can see an obvious dropping of the lateral hooding. So I'll usually get a Q-tip and I'll show them the skin and also at what level we can lift it to. And so if they kind of agree upon that and I can see skin we can remove, then they're a good candidate. We do want to make sure they're healthy, they don't have, you know, significant blood pressure problems or diabetes control. So we want them to be in tip-top health, you know, in order to go through with it and heal well.
What's the oldest you've ever done for that?
I've had patients in their 80s do
Wow.
eyelid lifts and facelifts. Yeah, absolutely. Once again, as long as they're healthy.
You mentioned diabetes, but are there any other health conditions that would preclude someone from being able to have the surgery?
If someone has had some significant history, such as heart attacks or strokes, those are high risk. We don't want to put them under surgical stress for an elective surgery. So those I would be hesitant, and I would definitely get a medical clearance from their doctors. So those be careful.
You made it seem, and I think this is a good thing. You made it seem like this is a minimally invasive procedure because and that the recovery time isn't super long.
Right.
But at what point am I going to notice an actual difference, and when am I going to see those brighter eyes?
Right. So the interesting thing about any facial surgery is that you swell a lot in the beginning.
Yeah, that's the scary part.
But the good news is, picture a boxer. When they get struck, they're really swollen.
Yeah.
But 3-4 days later with ice, the swelling's all down. So the first week's a little, we call it, you need to hide out for a little bit.
Yeah.
No important
From
meetings.
mirrors and other people.
Yeah.
Okay.
Yeah.
But the good news is, let's say you got to go run an errand, just put sunglasses on. You can go to the
Nobody
bank.
can see it.
Yeah, nobody can
That's
see it.
true. Yeah.
So when you start looking kind of normal, I would say is that 1 week when the sutures are out. And then certainly by the second week, makeup looking good. I don't think people would know. In fact, the comments the patients tell me are like, oh, you know, someone told me that I just looked rested.
Rested, refreshed.
That's what you want,
Yeah,
though,
that's
isn't
That's
it?
exactly, yeah.
Yeah.
So you say final results? You're already like noticing your almost final look in like a month, maybe?
Absolutely. At a
that's
month, I would say you're
awesome.
looking really good. I would say at 3 months, you're certainly at kind of a very close final. It's a very quick healing for eyelids.
That's
very, very
so
quick.
cool.
Are the sutures self-dissolving, or is that something they have to come back into the office to have you remove?
Good question. For any facial surgery, we put normally permanent sutures and take them out very quickly at 6 to 7 days.
Ooh, does
So
that
we
hurt?
don't leave. We're very gentle.
It doesn't
when we
feel
place it.
Sutures in your eye. Yeah. But
Very, very
you're very good,
gentle.
I'm sure.
Yeah. My nurses are great too.
Oh,
They take them out.
That's
yeah.
awesome.
Yeah.
Can you think of a time, maybe a particular patient who had a case where you were like, I am going to have to work some magic here. I'm going to have to use that creative energy that I have.
Yeah. Gosh, that's a good question. I'd say the challenging ones are definitely those who have aged more along the lines of, say, someone is 70 to 80, we mentioned, and they have a lot of skin that's hanging. I have to really mark out, and you know, people don't know, some people know this, but the most important part of surgery is the markings, believe it or not.
Really?
So when I'm marking upper lids, I actually spend almost 5 minutes precisely marking how much skin I'm going to take out, because this is millimeter surgery. I want to get perfect. So, and there's a running joke. I always tell my surgical nurses, don't wipe off my markings with the surgical preps.
Yeah.
Because that is, in essence, that's kind of the Lego manual. You've
Yeah.
got to like cut precisely.
Yeah. That's your blueprint.
That's the
that you have
blueprint
for your
to the
architectural work.
Exactly. I actually use that a lot.
Do you?
Yeah.
Absolutely. Yeah, it is a blueprint.
Giving you all sorts
But you were mentioning some of the complex areas is really kind of the lower lids. Because if we look at the lower lids, you may come to me and you may say, hey, Dr. Park, when I smile, I don't like these lines right around the lids. So there's a combination of I can take the fat out, but I also have to address the skin because the skin around the eye is the thinnest. So I might have to do a chemical peel or a laser on top of that.
Oh.
And I might have to do some Botox on the side because I can't fix the muscles I can't freeze them unless with Botox.
So you'd have to keep coming back for Botox every few months.
For the crow's feet, yes, we like to use Botox for that area.
That makes sense. What does a lower lid eyelid surgery entail? Is it very similar as far as coming in? And
Yeah, that's a great question because when we talked about the upper lids, we're looking at normally only skin, maybe a little fat in the inner side. But for the lower lids, people usually come in because there's fat. They call them the bags, right? The bags.
I've had 'em my
So you look great, by the way. But when people do notice, the bags, what that is fat that kind of relaxes over time. So we see the bulge. So how do we get rid of the bulge? We just remove carefully that fat. And,
so interesting.
Yeah, and I do that from the inside, so it's scarless.
Oh my God.
Yeah, it's pretty cool.
It's amazing. But I do, as you age, I have noticed, and actually one time I was playing a very old lady, so they put prosthetics here, but it was like, it was fat. Exactly.
Put bags on your eyes.
Amazing. Yeah.
It's horrible.
Horrible.
You never want that.
Oh, I
want that in real life, right?
I know. No. So I know what you mean. That's amazing.
Yeah.
Dr. Park, I know there are all different types of eye treatments. Can you give us an example of the different ones that you offer?
So when you're coming to me, it's pretty serious, because we're talking about surgery. But let's backtrack into kind of some of the non-surgical things that my medical aesthetic spa offers. So a lot of people that are young and they just see a little bit of fat there, we can inject in the nasolabial groove some fillers to disguise the Hill Valley Hill.
Oh my
So a lot of people will come in for fillers initially in their 30s and 40s to kind of fill in the little grooving there.
I did that once.
Yeah.
And I have to say, the person I went to, it hurt, but I've heard it wasn't supposed to hurt. That's
correct.
Yeah. So clearly I didn't go to the right person, but I did notice, and people were complimenting me constantly. Oh my gosh, you look so rested. And you're like,
That was pre-3 boys, right?
well, this is true. Yeah, that's true. That's true.
When you were actually getting rest.
But I do think it helps fill in that gap.
Yeah.
However, I have heard, and maybe it's the type of filler, so you can maybe go into that a bit too, but I've heard it can move. Is that true?
Oh, that terrifies
So it scared me. I never did it again.
It shouldn't move per se.
Okay.
But your point is very good. There's a lot of different types of fillers, and even before that, it's very important you go to a very experienced nurse injector because it's kind of like hiring a plumber. There's good ones and bad ones, or an auto mechanic. So injectors and surgeons are the same way. You can have good ones and experienced ones and inexperienced. So number one, know your injector. That's number one. But ask about the filler because now we have like 50 different fillers.
Which one's your favorite?
There's 2 products. There's Restylane products and there's Juvederm products.
Okay.
But once again, make sure your injector is educating you. To put it simply, there are soft fillers, medium, and firm. Some dissolve, some don't over time. So you have to be careful on what's going into your body. And so I like in the nasojugal groove here, kind of a medium firm filler.
Okay.
And it needs to be laid, in my opinion, deep so that it's on bone and it's more natural. Because if you go too close to the skin, you can get kind of lumpy, bumpy.
So in addition to the Botox and fillers, what other non-surgical eye procedures or special treatments do you offer?
I'm taking notes.
I know you are. I know
like
you're
this.
taking. I am too.
I'm making an appointment.
There's a lot.
Okay.
But to your point, the final trifecta, which I think is super important, is what you're doing to your skin, right? So the skin, you guys do skin, maintenance with lotions and moisturizers. I recommend everyone get on like a retinol because it's really turning over the skin. It's like cutting grass every day, making your skin rejuvenate.
Okay.
Now, once you get to the lower lid skin and starting to get really kind of loose, then we're in the realm of chemical peels and lasers.
Okay.
So I love and have a fractional CO2 laser that
always
can
wanted to do
really
that.
tighten that up
Yes,
easily
yes.
and
I
great
wanna do that.
results.
Is it painful?
Not really. It's kind of like
Oh, you went up there, right, Dr.
I never had
Park?
it done, but you do peel. It's analogous to getting like a sunburn. Let's say,
Okay.
yeah, and your
Okay.
skin turns brown
take
and it
that.
flakes
Yeah.
off.
Okay.
You can
I
tough
could
it
do
out.
it.
It's worth
I
it.
could exactly. No pain, no gain.
Yeah.
Are any of these kinds of procedures covered by insurance?
Unfortunately, most of these are aesthetics.
Okay.
Would
So,
you use CareCredit? Do you take CareCredit?
CareCredit is phenomenal. I
Oh,
would
good.
say a quarter to even sometimes half of my patients use CareCredit, which is a excellent financing option.
The CareCredit credit
For
card.
yes, and they can use it not only for my services but for veterinary and dental as well. So
Yes.
Right, for
it's
sure.
very
for sure.
functional.
It makes it more accessible because just because you can't afford to pay a lump sum like all at once
Right.
doesn't mean that you should have to sacrifice your confidence.
Right.
Yeah.
And how you look in the mirror is important to you.
Yeah,
Yeah.
absolutely.
I think it's super important because if you're going to buy a car, who pays 50, 100 grand all in cash? We all
Right.
finance.
We all finance
And
it.
so, I mean, this is your body, probably more important than a car or house. I certainly wouldn't mind financing it intelligently, of course.
And then you actually get to do what you want to do as far as cosmetic procedures.
Yeah,
Yeah,
absolutely.
that's-
Taking care of yourself.
Yes. So you have the CO2 laser. Have you, what other, is there micro needling, is it?
There
Or-
are.
Okay.
Wow.
Well, you know,
That's pretty
She's
good.
done a little bit of
Love
research,
it.
Dr.
Yeah.
Park.
I need to be fixed after I'm done breastfeeding this last baby.
She's
Fix
coming
me.
She's
over,
ready for her
yeah.
mommy makeover. Let's starting with the eyes.
Yeah. From the head to the toe.
That's
The
right.
eyes are the first, yes. But to your point, so talking a little bit about the different services, we talked about surgery. We talked about kind of minimally invasive, which are the fillers, Botox, and CO2 lasers. But thirdly, what you're pointing out is really important is maintenance. And so our aesthetics spa does offer those maintenance like microneedling. HydraFacials are
Ooh,
fantastic.
what's a HydraFacial?
I've had one of
So
those.
You have?
I have had a
Oh,
How did it
HydraFacial.
feel?
Fantastic.
Why?
Why
I
not?
want to hear all about this. I want it.
Oh my gosh. Well, because I mean, I get regular facials. Every
Yeah.
month I get a
Important.
facial, right? And when I'm not like in character, in full makeup, I try to just take really good care of my skin,
Good.
drink plenty of
Yeah.
water all the time, and stay out of the sun. That's
I
the
need
main
Bingo.
thing.
Very important.
Yeah, and
Really
and I
important.
always wear some kind of a sunblock
Sunscreen,
every day.
hat.
Yeah.
That's really
Every
good.
day. Yeah.
Super
Yeah.
important.
I learned my lesson
Yeah.
the hard way. I just
Yeah.
had 2 bouts of skin cancer.
Oh,
Did
honey.
you?
Yes.
Oh, honey.
Yeah.
Basal and melanoma.
My goodness.
And
Yeah, I learned my
melanoma.
lesson. I mean,
Yeah.
I'm a sun baby. I grew up here. You know, it's
Yeah.
like it's so hard. But
Yeah, my wife also, and if you're more fair skinned, you are more prone to skin cancers, as we know. So, yeah, the sun protection is so important.
Oh,
Yeah.
And even with this year-round tan that I love, I always make sure, really, like from head to toe,
Yeah.
that I'm covered and I'm protected because just because my skin has more melanin in it does not mean that
not
I don't need
yes.
sunblock and just to
Absolutely.
keep the wrinkles away and
Exactly.
all of that. But the
That's the key.
HydraFacial.
okay,
Oh
so the
my
HydraFacial's good
gosh.
for maintenance.
HydraFacial's great. Lisa, who's
okay.
my esthetician, it's a machine whereby it injects, through another applicator, kind of moisturizes and water facial type procedure. But it's fantastic. Yeah.
They say a lot of brides do it, like
Oh,
before they
really?
get married. I mean, not right
That makes
before,
sense.
but like they space it out and they
For that
know like
dewy look?
Yes,
Yeah,
and
that
I
makes
could tell. Like I walked out like,
I
like
am
one of
doing
those.
this.
You need to
Okay.
get it
It gives
done,
you
girl.
that
Call
nice
Dr.
glow.
Park.
Yeah.
Call him.
Yeah.
I am.
Yeah.
Seriously.
She's like, no, I'm serious,
Come
Dr.
on
Park. I am
over.
calling
You
you.
guys, let's go.
Let's go now.
right now live.
And we will
Yeah.
film it. Yeah.
exactly.
And we're done. Let's go.
And we're finished. And we're done.
But
Yeah.
did you feel like a nice glow?
Oh,
Is that kind of like
felt it. I
Yeah.
saw it.
Yeah.
And it lasted, right?
Yeah.
But
Really?
yeah,
Oh, that's
yeah.
good to
For
know.
I would say
Yeah.
a full week, I felt really good.
Exactly.
The thing
Exactly.
about
About
it,
a
though,
week.
that my esthetician's always stressing because I love to work work out. Like I live in the gym just the way you used to get to live in the gym, and I know you want to get back into it. You have to be careful with like sweating and exerting too much afterwards. No, just to protect what you just did, like the work. If you're gonna invest in that, you got to protect it for a couple days at least. No saunas, that kind of thing.
Well, I wanted to ask Dr. Park, as far as all of those procedures on the eye and even the non-invasive and the cosmetic ones, does sweating, to Melissa's point, I've heard that I sweat out my Botox very quickly. Does it, like, you metabolize it because you sweat so much? Is that true or false?
I don't know if there's any evidence of that per se, but the more you do use a muscle, perhaps that can kind of disintegrate the molecules.
That makes sense.
So here's an example. For example, males, we tend to have stronger forehead lines and such.
Sure.
So they will need more of a Botox dosing, for
Not
example.
as strong as my forehead muscle.
You must have kids that kind of get your brows going.
700 units later.
Frozen.
Yeah.
We're gonna need another dose.
Yeah, exactly.
Another
Round
vial.
2.
Another vial.
But yeah.
But yeah, I understand. So you're exercising the muscle.
Yeah,
so to
exactly.
speak.
And that'll kind of dissipate the molecules over
Okay,
time.
that makes much more sense.
Look at Dr. Park over here doing the myth busting. It's our
As
myth
usual.
busting
We like
section.
it.
Okay, we have this section of our pod called Ask the Expert. So these are
Okay.
questions from the audience. Do you want to start?
Yes,
Who's the expert?
You are
Okay,
Dr.
all right,
Park.
let's
You're
go.
the
All
expert.
right,
I can
I'll
start if
try.
you want. You have.
I'll do my
Okay, go for
best.
it.
I will start, but I will say, do you recommend eyelid surgery? You say it.
Blepharoplasty.
There you go.
Yeah.
That's why you're the expert.
Exactly. Versus Botox for sagging eyelids on a 46-year-old woman.
Ooh, great question. Here's where the physical exam is super important. So I need to see if there's extra lid skin that can be a surgical candidate, because early on, Botox works great, once again, to a really good injector to give you a little bit of a brow lift. Botox can do that aesthetic as well. So depending on what the exam looks like, she can go either way.
Okay.
Yeah.
Great.
Okay, this person says, I had an eyelift and facelift 6 years ago. Should it not be holding up after this short time?
Wow. Depends on who you went to.
I knew you were going to say that. I knew you were going to say that.
I mean, there are, again, the surgeon's very important. There's a lot of different techniques. There was something called a lifestyle lift several years ago where they were doing quick facelifts, lunchtime facelifts, and they were kind of skipping some steps here and there.
That's scary.
And that's just
Me
not
too.
going to last.
Right.
So a facelift should last, in my opinion, 12, 15, 20 years.
Oh, wow. Okay.
Yeah.
That's good.
In my hands.
Okay, here's another one for you. Are eyelifts effective for reducing under eye bags or sagging, which I think you've kind of touched on already?
Yeah, so I think we're talking about two different things. If we separate the upper lids, we're talking about skin removal. And then in the lower lids, it's usually fat removal and tightening skin at the same time with like a CO2 laser.
Okay.
Yeah.
But they are effective.
Very effective.
okay.
Absolutely. I tell people, I want you looking 10, 15 years younger, rewinding your clock just from doing your eyes. Yeah.
Amazing.
Yeah.
Which it really does. The
Yeah.
eyes are the window to the soul.
Windows to the soul.
There you go.
And we just want you to look rested, and
Yeah.
the very first, I'm communicating through my eyes with you. We're always looking at eyes, and the very first comment is, oh, you look tired. It's usually the eyes.
Yeah.
So let's get the eyes
Absolutely.
refreshed.
My son's 5.5 years old. That's how long I've been looking tired.
Yeah.
So there you go.
Exactly.
You both look great.
You're so kind. Dr. Park, it is such a pleasure to have you join us and to bust some myths, to answer some questions, and to really give us an education on how we can better take care of our eyes and also look refreshed and rested.
Yes. Thank you so much.
Thanks for being
You're
here.
welcome. Thank you.
Thank you so much for joining us and being part of our growing community.
Stay tuned for new Care Expert episodes every Wednesday. And don't forget to subscribe on your favorite podcast app and YouTube.